Hey guys, Tony Maritato here, and this morning I want to talk to you about the differentiation between therapeutic exercise, CPT code 97110, and therapeutic activity, CPT code 97530. Now, in my article, I list screenshots of the multiple sources that try to describe what these are. For reference today, I'm going to be using a CGS source. It's the L3409 LCD. You can look it up. I'll put a link in the description below. But if we look at these two descriptions side by side, at least according to the CGS MAC, this is some of the stuff that needs to be recognized and kind of stand out when you're thinking about, do I bill this as 97110 or do I bill it as 97530? So in terms of therapeutic activity, basically, CGS says therapeutic activities are considered reasonable and necessary for patients needing a broad range of rehabilitative techniques that involve movement. Movement activities can be for a specific body part or could involve the entire body. Now, as clinicians, we treat the entire body, we treat the entire human, we take everything into account, right? So it says this procedure involves the use of, quote, functional activities. So therapeutic activity, CPT code 97530, is focused on functional activities. For example, bending, lifting, carrying, reaching, catching, pushing, pinching, grasping, transfers, bed mobility, and overhead activities. So what I would do as a physical therapist, creating a documentation template, either for a treatment note, for long-term goals, for my plan of care or evaluation, is I would literally take those specific functional activities. I would either use an established functional outcome measure, and I would list their deficits during the initial evaluation, the patient's deficits, and then each one of my treatments would focus on at least one of those functional activities. And so if I'm going to choose to bill 97530 CPT code, I want to tie it to one of those activities that I've identified as being deficient during the initial evaluation. Now let's flip that over to therapeutic exercise. So by definition, according to CGS, therapeutic exercises are used for the purpose of restoring or maintaining strength, endurance, range of motion, and flexibility where loss or restriction is a result of a specific disease or injury and has resulted in functional limitation. So this is related to strength, endurance, range of motion, and flexibility. Therapeutic exercises may require active, active-assisted, passive participation by the patient. For example, isokinetic exercise, lumbar stabilization, stretching, and strengthening. These are the examples that CGS provides us. And then just one more sentence here. Many therapeutic exercises may require the unique skills of a therapist. That's what makes it a covered service. To evaluate the patient's abilities, design the program, and instruct the patient or caregiver in safe completion of the special technique. So it's not so much, Medicare is not so much paying you to actually do the program. Medicare is paying you, the therapist, or a physical therapist assistant under the direct supervision of a therapist, to evaluate the patient's abilities, design the program, instruct the patient or caregiver in safe completion of the program. And so what I try to tell all of my students that have taken the Zero to Paid course is, once you identify the deficit, whether we're talking a functional limitation or a physical impairment, once you've created the program to address the deficit, you have a choice. You teach the patient what to do. Either the patient can do it, and once they've learned how to do it correctly, your job is done, or you determine the patient is incapable of doing it independently and or doesn't have the support around them. They don't have a spouse to help them. They don't have aides to help them or any kind of other assistance. In both cases, you're done. You've done your job as a therapist. Medicare does not continue to pay us to deliver the services in the absence of having support personnel around the patient who can deliver it, or if the patient chooses not to perform what we prescribe. That's a really hard concept for therapists in a lot of settings, because we're here to help, right? We want to treat, we want to fix, we want to help the patient get back to their best possible life. but that's not really what Medicare is paying us to do. So guys, if you really, really want to understand the difference between these various CPT codes, go to the source. Whoever your MAC is, go find the sources published by your specific MAC for your specific state. If you're dealing with a non-Medicare insurance plan, go to that plan, find their resources for documentation guidelines, and really get specific, like tease out the definition so you can better understand when you bill, what you bill, why you bill it, and what the insurance plan covers. If you have more questions about this, let me know. I'm going to review a couple other common CPT codes for physical therapy, occupational therapy, and I will post those videos here in the next week or so. Thanks so much for watching, guys.